Welcome to the Ordinary Doula Podcast with Angie Rozier, hosted by Birth Learning, where we help prepare folks for labor and birth with expertise coming from 20 years of experience in a busy doula practice, helping thousands of people prepare for labor, providing essential knowledge and tools for positive and empowering birth experiences.
Hello and welcome to the Ordinary Doula Podcast. My name is Angie Rozier. I'm the host, and today's topic is I'm going to dive into what the role of an obstetrician is during labor and birth. So when families, and I hear this so many times, right, over the years, when families picture their birth and their birth team, they often think of the OB as being there every step of the way, right? Like it's us and our doctor. But the reality of that throughout the process is a little bit different than that vision. Obstetricians bring incredible medical expertise to your team. They're an essential role in managing, how labor goes and managing pregnancy too, for that matter, especially towards the end. They take up their care and their observations and are pretty cautious about a lot of things in all throughout pregnancy, but especially at the end. So they manage complications and ensuring safety, right? Medical safety, physical safety, all of that. But they're not usually the ones that are sitting there at bedside. They're not super present throughout the labor process. That's where, you're going to be with your nurse a whole lot more than you are your doctor. You're going to be a lot of times with a midwife a little bit more than a doctor, and doulas, you're going to be with your doula a whole lot more than a nurse or a doctor. And partners, you're going to be with a partner a whole ton, right? So we're going to kind of explore exactly what OBs do during labor, when their presence is crucial, how their role kind of fits into the big picture of your birth team, and whether you're expecting a baby or you're supporting somebody else who is through the labor process, or if you are a birth worker yourself. It's just important to understand the scope of an OB's role. It can help set some expectations and kind of create a space to collaborate on the birth team, because we do want a lot of collaboration there. All right, so what is an obstetrician? An obstetrician is a medical doctor. They specialize in pregnancy, in birth, and a whole lot of other stuff like reproductive health, hormones, menopause. Obstetricians have pretty deep training, right? They've gone to medical school, residency. They are surgeons. They've had surgical training. So this can be quite different than midwives and maybe a family doctor, in that their medical training is a bit more extensive when we get into some of those more complicated things. So during the labor process, the role of an OB is to review things. They have reviewed and are aware of health history. Now you meet with your OB if that's who you've chosen as your provider throughout pregnancy, right? So you have visits in early pregnancy, whether that's, whatever weeks you can get in. I was talking to a very newly pregnant mom a little while ago, and gosh, they couldn't get her in for like 2 months, pregnant or not. So that was a very busy OB office, but you're going to be meeting with this OB and getting prenatal care, right? All throughout the pregnancy. They review your health history. They're going to kind of keep tabs on things. They're going to get a baseline early on about some things that they're going to want to watch a little bit later. They, near the labor process, are going to be checking on reasons for induction. And you want to understand reasons for induction, right? They're going to monitor risk factors that would create reasons for induction. Now, sometimes the quote unquote reason for an induction might be, I'm going to be out of town, or you are 39 weeks, or, it just depends. Like, is that legit to you? And so dig a little deep with your doc and see what your comfort level is on. Are these true risk factors, or are they not? But they will be checking on a lot of, that's who helps you decide on an induction, is your OB. Nurses don't touch that. Doulas don't touch that. They may discuss some things with you, but that is a decision you make with your doctor. During the labor process, OBs are monitoring, right? Probably from afar, but they always have access to what we call the strip, like the strip of the baby's heart rate, contractions. The nurses are going to be much more close to you in proximity and doing that monitoring physically. but the docs have access to it, and they can help decide on interventions when they need them. That might be induction methods, augmentation methods, cesareans, assisted delivery. So when there's a big change and a shift, you better believe that your OB, if that's who you're working with, is going to be involved, or your midwife for that matter. They may manage complications such as fetal distress, shoulder dystocia, hemorrhage, the stuff that comes up that we don't want to. The stuff that sometimes comes up quickly, that's where their training and expertise comes in. So if everything is super smooth, boring, healthy, your OB's skills are set to the side, right? They still have great experience. They've done this many, many times, but their deep skill set isn't needed. It's there for when we need it, which a lot of the times is not like anyone can deliver a baby if everything is fine, right? Babies just come on out. They need somebody to kind of have a catch pad there for them, but the OBs are there for when things get a little bit interesting, of course, and they're prepared for that. So during labor, they're not super present. Their decisions might be present, but physically they're not present. They might pop in at lunchtime during clinic hours, or before clinic hours, or after clinic hours, before they go home at night, whatever that might be. But they are not usually very. You don't see them a whole lot. So many times I've had the partner ask, or the birthing mom ask, like, hey, where's my doctor? Like, here we are doing this, like, where are they? When do they come in? And it's usually a bit later. So let's move towards delivery and birth. Docs, your OBs, are typically present near or towards the end of the pushing stage, right? Which sometimes comes up quickly in labor. Sometimes it takes days to get to this point. They are responsible for the safe delivery of the baby and management of the placenta and bleeding. So third stage is delivery of the placenta. That's what we call it. That's when their skills like start to shine, right? I mean, if they probably have been already, but that's when they get really keen on what's going on, right? The baby's born, you're holding the baby, you're like, awesome, everything is great, we did it. And your doc's like, you know what, we're watching for this placenta to come. They're going to make sure it's complete. They're assessing blood loss at that point, any tissue separation, whatever they need to repair. They're assessing you and your vitals afterwards. So they might just be looking like they're sitting there to you, but that's when their skills are really shining. So immediate postpartum assessment, right? For mom and baby. They don't do baby care. A lot of them are, I mean, they're going to do immediate, assessment of baby, but other specialists come in for that if needed. And OBs typically address complications like tears, hemorrhage, blood pressure issues with mom afterwards. So here's kind of what OBs don't do. We already mentioned it. They don't do continuous bedside support, right? That's your nurse will be with you a lot more. Hopefully you're working with a doula, will be with you a whole lot more. Midwives are a little more present as well. They don't do comfort measures like massage, or positioning or emotional coaching. However, during that pushing stage, I've seen lots of OBs like collaborate with the parents, with me on like, hey, what can we do to maximize pushing here in what we call second stage. They might do some emotional coaching insofar as they're going to like motivate you to push, or to push well, or whatever that might be. They may, if they have to address a real delicate situation, say we're moving towards a cesarean, that's some emotional coaching too. I've seen some docs be super cold, you could say, like just like, hey, this isn't working, you got to have a C-section. I've seen other doctors be incredibly gentle about that and cautious about that because they know how the person feels about it. I've seen a couple docs just like sit right on. One guy climbed right in the bed and just cried with the mom. It was super cute, actually. So sometimes there is emotional coaching. Don't count on it and don't rely on it. But they are sometimes an emotional coaching that way. And it's not that they don't care, right? They don't care, but it's not their role. It's not their job. It's interesting though, because you meet with them very regularly throughout the whole process. It would make sense. They're going to be with you through the whole process, but just have that realistic expectation that they're not. Now, here's something that's very cool that I love about OBs and or midwives for that matter. And I think I've probably done an episode a little bit about this, but the energy shift when someone enters or leaves the room. So a lot of times doctors come in at the end and the team's tired at the end, right? Whatever labors looked like. We might have been working on it for days or hours. Maybe everybody's lost some sleep for sure. and we've been with each other for a while, right? We're all in sync with each other. We're kind of in each other's soup. And then the OB comes in at the end and it's time, right? Like something shifted. If they're coming in the room, we're pretty close to having a baby. And when they bring in that energy, I have appreciated that so many times. They probably look at us like, I am the hero. I came in and we had a baby. And while that might be true, like a lot of work was done without them in the room, right? There's a lot of heroes in this space, and they all have kind of different roles. But that shift of energy, just somebody else come in a room, and when we call it, I call it the biggest nervous system in the room. All the nervous systems, like me as a doula, the partner, the birthing person, the nurse, like our nervous systems kind of have a as we work and collaborate as a team, there's like a little bit of a hierarchy to those as we arrange to take care of each other, and sometimes we'll trade around in that. But the nurse and the doula are taking care of this person or this couple or this mom and baby, whatever that is. And then the doctor comes in the room. They have, just by social contract almost, they have a pretty big nervous system. We could call that an ego, but honestly, it's about the nervous system. They come in with a new energy. Sometimes they don't read the room and it's the wrong energy, but they come in with a new energy, and that gives energy to other nervous systems. So it looks scripted, like they come in and they are the hero. But I love that, as sometimes I'm like, gosh, we just need a doc to come in here and say, awesome, good job, and just shift our nervous systems, all of us in the room. So I do love that. That is some weird, subtle emotional coaching. They don't know they're doing it, but that is pretty awesome. I have seen some providers like do tug of war pushing if we're having a long second stage. I've seen some probably far and few between, but I have seen a couple OBs do a little counter pressure or massage just briefly. Again, it's not their role. It's not that they don't care, but they don't have time to do that for everyone. That's not where their expertise lies. That's in your support people, your immediate support person, your doula, things like that. So you want to, the birth team needs to collaborate. There's a great collaboration that goes on here as we use the expertise of everyone in the room. So doulas, nurses, and OBs all work together. They all wear different hats on the team. So ask questions as you collaborate with your team. Ask questions before labor. Ask questions at prenatal visits. Get to know what to expect. Get realistic expectations. As a doula, I give my clients several talking points to take as I first meet with them. Take these to your OB visits. See what your OB thinks about this, says about this, how do they support this? And sometimes I'm like, based on what I'm hearing you want, you might want to clarify this with your OB. So talk early and often with them. A lot of people have said they kind of complain about like they don't remember me from visit to visit. That may be true. They're going off of charts. They see a lot of patients. They run together. Again, their role is not to be your cheerleader and your champion, but to watch out for the medical safety of you and your baby, right? So don't lean on them for all that emotional support. It's quite not quite their role. Some of them give it, but don't lean on them for all of that. Learn about your OB's philosophy and their style. Some OBs are a little callous sounding and feeling to some people. That might be great with some people, right? Other people like, oh, that's not a good match for me. I need somebody a little more gentle approach, a little tender approach. Very recently, I was at a hospital, and somebody who knows the hospital well, works on the inside of the hospital, was having a baby, and chose a provider. And this person had a lot of complications actually to their pregnancy. They were having a baby, had a lot of things going on, and they chose one of my least favorite demeanor doctors as their provider. And they specifically didn't choose one of my very favorite demeanor doctors. Demeanor meaning like how they approach people and patients, and their warmth and their kindness and their empathy. They chose a very frank, very curt, kind of a no nonsense kind of doctor. She's like, that's what I need in my situation. I don't need, the coddling of such and such doctor, which was really interesting. I like 10 and a half times out of 9, I would have chosen the other doctor. But in her situation, I could see she was using this doctor for their expertise and their experience, not for their emotional presence. She had other people for that. So keep that in mind. So learn about your OB's philosophies, their style. Ask other people who've been with them. Ask a doula who has worked with them a lot or at that hospital. Use your birth plan as a communication tool. create that, whether you create that, there's great online sources, create that with a doula. You and your partner kind of look it over, take that in, say, hey doc, here's kind of what I'm thinking. They may just X out some things, disagree with some things that'll help you get a sense of their style. They may suggest some things to put on there. But it's important to get in a space of respectful teamwork with all the roles before we get to the game, so to speak. So when OB's role is most crucial is in those high risk moments, right? Which are really aren't very common. They're also with high risk pregnancies. We have in our country, there is a lot of people actually deemed high risk. This doesn't mean life and death, right? But there's co-founding morbidities, we call them. That might be age, that might be number of pregnancies, that might be chronic health conditions, that might be autoimmune things, that might be hypertension, chronic, might be obesity, it might be all kinds of things that could take a pregnancy, it might be multiples, and put it into a high risk category. So that's where we want that medical expertise. Emergencies, right? We want them there in emergencies. They know what to do, they know how to act quickly, and the whole team does, right? The nurses, the surrounding staff, they are trained for emergencies. Thank goodness they don't happen very often. At one of the hospitals I work at, a few months ago, we had an emergencies come up sometimes, and there was an emergency. I was happened to be working down the hall, and I saw a team just running towards the OR. I'm like, oh, something's going on, something's going down. And there was a nurse so nurses are a huge part of the team when there's an emergency. There's a nurse who was on the bed that was rushing down the hall with all the staff surrounding it, going towards the OR, and the nurse was kneeling on the bed with the patient and there was a prolapse cord, if you know what that is. The cord comes down in front of the baby's head, and this nurse was kneeling on the bed and pushing that baby's head up off the cord. Talked to her afterwards, like, oh my gosh, my hand was like crushed as she held that baby's cord up so the baby could get blood flow, right? We do want our OBs there in emergencies. They know how to act quickly with the team that they work with. So that could be sometimes cesareans or emergencies. Usually they're not. This particular one was in hemorrhaging situations and shoulder dystocia situations, managing high risk pregnancies, and sometimes in a very calm and normal way. But that's where we want their expertise. Complicated labors. Sometimes labors are just, a lot. And they are such an important part of that team to keep everyone safe, right? Everyone meaning even the uterus, right? And that baby, and they can help with those complicated labors or ones that require medical or surgical expertise, whether that's instrument assisted delivery, abdominal or cesarean delivery. That's where, gosh, we're so grateful for those skills. So kind of recognizing OBs for what they are and what they're not. We love them for what they are. Don't expect them, bonus if they are a little above and beyond that. Some are phenomenal. Some OBs I've worked with over the years have an approach, a demeanor that's much more like a midwife, and they do want to be present, and they are empaths, and they are emotionally connected and involved. Others are not. So if they aren't, seek what you need elsewhere so you can create a full birth team. So as we wind down, kind of some of our takeaways are recognizing the OBs bring vital expertise, right, to ensure medical safety of all involved. Most of the time they step in during the very end stages, or actively if there's complications or anything prior to that, but they're usually just there for delivery. Keep that in mind. A lot of other support team is there a whole lot longer, of course. So as we finish up today's episode, hopefully this gives you kind of a pretty clear picture of what an obstetrician's role is during the labor process and what it is not. They're just highly trained specialists, step in with the medical skills when they're needed and when they're needed most, right? They manage complications, guide interventions, and help as things take their own twists and turns. Sometimes we use a fraction of their skills, we hope, right? Sometimes we're going to be using all their skills. There's one OB I worked with I've worked with him several times, but years ago we had a tough case, like, so one of the toughest of my entire career, and a long surgery ensued after after a cesarean, and that OB came in hours later to me and the dad. We were just waiting in the waiting room for this. He was hot, sweaty. It was the middle of the night by this point. He looked terrible. His hair was messed up, sweating on his scrubs, and he just plopped down right in that waiting room with us. And he admitted, like, in his very human way, which I appreciate, like, wow, guys, that was hard. And with a really tricky situation. So remember, they're people too, right? And a lot of what they may recommend, they've seen a lot of stuff, probably hard stuff. They've seen great stuff, but the interesting thing is they are aware of what's possible and they don't want the worst things to happen. Sometimes the worst usually doesn't happen, obviously, but they have seen it. And so sometimes to them, right, they have traumatic experiences too. A traumatic experience that they've experienced will trickle down into their other patients' care. So take that, keep that in mind as you're working with OBs. If they seem stringent on something or strict about something, like, they've probably seen some rough outcomes because people, want things or make certain choices. So remember that they're an important part of the birth team. There's other members too, nurses, doulas, partners, other family members, all bring different kinds of support. That's physical, emotional, informational support, and OBs bring medical expertise and support. All of that complements each other, right? Everybody's expertise everybody has a different hat to wear. All that comes together to make a good team. And when people work together with respect and communication, the patient feels safer, right? More supported. They can have an empowering birth process. And that's what I always want for people. So as you prepare for birth, take time to learn about your particular OB or provider, whoever your provider is. What's their approach? Ask them questions, talk to them. You have a few minutes with them every few weeks, probably, right? And use that time. Go in with questions and collaborate with your OB. That preparation makes a world of difference. Hopefully it'll make a world of difference for you too, and you've chosen a really good team. So I want to thank you for being with us today on the Ordinary Doula podcast. Hopefully that gives you a clear picture about what an OB is and what they're not. There's so many OBs I just sure appreciate and have worked with, probably hundreds at this point. And they're such a huge, important part of the birth team, and I sure do appreciate them and the care that they give to all of us. Appreciate the work they've done to get to where they're at. So wrapping up this episode, again, thanks for being with us today. This is Angie Rozier with the Ordinary Doula podcast, and as always, I want to close with making human connection. Please make a positive human connection today. You'll need it, and somebody else will as well. You never know what you'll do for somebody else's day. The joy you'll bring as you do that. Hope to see you next time, and have a great day.
Thank you for listening to the Ordinary Doula podcast with Angie Rozier, hosted by Birth Learning. Episode credits will be in the show notes. Tune in next time as we continue to explore the many aspects of giving birth.